Have you ever forgotten where you left your keys? Did it make you wonder if this was because you're getting older or perhaps something more serious like dementia? The fear of losing your memory and independence, becoming a burden to others, and concerns about how this will affect your loved ones can be frightening. You want to catch dementia early because you can significantly slow down the progression and live a better quality life. So let's explore 5 warning signs of dementia. At the end of this video, I'll also tell you about the breaking news from a promising new study, the first of its kind on dementia treatment. Hi, my name is Dr. Air. I'm a board-certified lifestyle psychiatrist. Imagine your mind as a beautiful, vibrant canvas. It's filled with the rich colors of your memories, experiences, and knowledge. Dementia is like an invisible artist who slowly starts to paint over parts of this canvas. At first, it's barely noticeable, but these layers build up over time, slowly destroying the once vibrant canvas, your mind. That's dementia. There are several types of dementias. Alzheimer's dementia is the commonest. Some other common dementias are Lewy body dementia, vascular dementia, and frontotemporal dementia. Parkinson's disease, Huntington's disease, head trauma, alcohol, infections, and drugs can also cause dementia. So let's talk about the first warning sign of dementia: memory problems. In early dementia, memory problems are mild and usually related to recent events. People forget telephone numbers, conversations, daily events, and names. Imagine a loved one with dementia who no longer remembers the names of their spouse and kids. This can be devastating. With time, people begin to struggle with their orientation. For example, they may forget how to get back to their room after going to the bathroom. As the dementia worsens, memory becomes more severely affected, and only the earliest learned information is retained. An example will be a person's place of birth. As a person's memory declines, they may try to deny or rationalize their forgetfulness to hide it. Also, they may display excessive orderliness, become withdrawn socially, or begin to relate events in minute details. Number 2, personality changes. This can be very disturbing for family and friends. Some personality traits the person already has may become stronger with dementia. For example, someone who has always tended to yell may become even more verbally aggressive. People with dementia may also become introverted with sloppy grooming, negative remarks, and silly jokes. Some may also appear less concerned about their behavior's effect on others. Sudden outbursts of anger or sarcasm can occur. I once had a patient whose wife was devastated because her loving husband had become verbally and physically aggressive with her. She was in tears describing his transition from a loving husband and father to one who no longer knew their names and was now very irritable and explosive. Number 3, altered mood, hallucinations, and delusions. In about 40 to 50% of cases with dementia, depression and anxiety may occur. People with dementia may also have pathological laughter or crying. This means that they can suddenly begin to laugh for no reason and then suddenly switch to crying. About 20 to 30% of people with dementia have hallucinations. A hallucination is when someone sees, hears, smells, tastes, or feels something that isn't really there. About 30 to 40% of people with dementia have delusions. A delusion is when someone strongly believes something that isn't true, even when there is clear proof that it is false. Examples will be someone refusing to eat because he feels family members have poisoned his food, or that the government was transmitting radioactive waves to his body through the television. Sadly, physical aggression and violence are common in people with dementia who also have hallucinations and delusions. Let's move on to number 4, changes in posture, decreased movement, and loss of arm swing. As babies, we start in a curled fetal position. As our brain develops, we stand upright, and as our brain ages and declines, we revert back to being hunched over. As dementia progresses, people develop a stoop posture, rigid, slow movements, and in some cases, shuffling movements when they walk. They may develop muscle weakness and stiffness. This leads to decreased physical activity and difficulty maintaining balance, increasing the risk of falls. Slow movements known as bradykinesia can make everyday tasks more challenging. Also, the inability to start and plan movement, a condition known as apraxia, can cause them to freeze. All of these changes can significantly impact the quality of life in people with dementia. Number 5, language problems. This can present as difficulty finding words, a condition called anomia. People with dementia may struggle to form proper sentences or lose the ability to understand language. Some repeat phrases, substitute incorrect words, or create new words without meaning. It becomes difficult to hold conversations with them as they lose their train of thought. This can lead to frustration for both the individual and their caregivers. Breaking news. For the first time, a study has shown that intensive lifestyle intervention without drugs may significantly improve brain function in people with mild or early dementia due to Alzheimer's disease. This makes it even more important to catch dementia early because there is hope. Now that you know the warning signs, it is important to understand how to prevent or slow dementia. Check out this next video where I talk about dementia prevention.